UBC, inspiring Uganda.
In an era where digital technology is reshaping daily life, smartphones have become essential companions in promoting health awareness and improving access to medical care across Uganda. From learning about diseases to consulting doctors online, smartphones are closing long-standing gaps in Uganda's healthcare system. For Joshua Asimwe, smartphones are more than communication tools. They help him monitor and track vaccine availability in his community, ensuring timely access to life-saving immunization.
This is the company that has designed and is now implementing a vaccination tracking system that we have called Pekin. It is the Pekin app. So this is a comprehensive vaccination tracking system with an integrated EMR that helps health workers, mothers, the ministry, and each and every other health stakeholder to actually track and find out whether these children have taken their vaccines, have they missed any vaccines, what catchment areas are missing out on certain doses of vaccines. We're able to find out whether we are having vaccines in stock, whether they're out of stock, which vaccine is more being used, which one is being skipped by most parents. So what happens is that the smartphone, we're having the offline side of the app. So when we are having the offline side of the app, this cannot be used on these laptops and the computers, so we opt for the mobile devices. For example, when the head nurses go into deep villages whereby there is no internet, they can access the app offline, put in the information, and then when they get back where the internet is, the information is automatically uploaded to the online side of the system. So the smartphone mainly is to keep the parents engaged and to feel like they are part of the entire process.
With a few taps, anyone can now research symptoms, explore treatment options, and access credible health information through trusted websites and mobile apps.
We have found out that people remotely have been able to meet consultants. They do a lot of consultation using smartphones. So for now, it is not very necessary for you to do a physical meeting with a consultant in case you have a challenge. You can remotely use your smartphone, and that is what people are doing of now. A biggest percentage of patients are able to access the consultation of some of the specialties, the doctors, and even some of the medical personnel that can have help.
Telemedicine is rewriting healthcare delivery. Patients can now connect with doctors through video calls or messaging apps, saving travel time and costs, especially for those in remote areas, and receiving faster medical attention in emergencies.
We saw this mainly in COVID-19. We remember we used to consult our doctors via Zoom, which has now turned into a business model where startups have gone on to build telemedicine platforms. For example, NetDoc, which was in Uganda, where you can consult with your doctor, get prescriptions. We have seen lab management systems, and we have seen telepathology, teleradiology, where you can get your lab results, you can get your radiology results in a single click on your mobile phone. So this has not just empowered patients on the control of their health, but it has also increased healthcare access. And this is what I want to highlight when it comes to the adoptions the Ugandans have made. Digital health and digital health platforms are not just here to increase the cost of health. They are here to make sure that there is an increased access. So if you talk about countries, especially in the sub-Saharan region, where the doctor-to-patient ratio is really high, it means that you need ideas that can ensure that one doctor can serve a larger population without them being wary, without them being frustrated with the population.
Very many women now are able to detect their fertility rates using smartphones. They are able to know their menstrual cycles. So it is through these smartphones that women have been able to access all these services, because there are some applications on smartphones that women can download, and they ask you a few questions, and then when you put in those questions, they are able to give you a calendar for your cycle.
Smartphones are also improving treatment adherence. Alarms and health apps remind patients to take their medicine and keep appointments, small digital nudges with big impacts on recovery.
Let us invest more in our local startups to innovate more digital health solutions rather than us just picking solutions from anywhere. We can build something great in this continent. I think the other thing that we need to think about is how we make the internet more accessible and cheaper, because without internet, there is no way digital health can survive.
So if the people who sell smartphones, they lower the price, and now this brings in the government to also negotiate on the issue of taxes, because they vary the price of a phone depending on the tax that they paid for this phone.
We can have the smartphones being built here within our countries, and then with that, they would become more affordable for the population.
As Uganda embraces digital transformation, smartphones are no longer just gadgets for connection. They are digital lifelines linking people to medical expertise, vital health information, and a healthier future.
UBC, inspiring Uganda.